Imagine you're walking into just a crowded room just to buy a cup of coffee. To anyone on the outside, it looks perfectly normal. You
Yeah,
know,
completely mundane. You're just waiting in line.
right, you're waiting in line, you're checking your phone. But inside your mind, you have just stepped into this incredibly high-stakes courtroom.
Oh, wow.
Yeah, and you are the defendant, you're the prosecuting attorney, and you are the deeply, deeply unamused judge.
That sounds exhausting.
It is. Every microscopic movement you make, like where you look, how you hold your wallet, maybe a slight tremor in your hand, it's all being recorded, analyzed, and harshly criticized in real time. But the trial is entirely invisible to everyone else in the cafe.
I mean, it's exhausting just to visualize that scenario for a few seconds. And it is completely debilitating to actually live it, day after day. You're constantly anticipating a guilty verdict from, well, absolutely everyone around you.
From your boss to a total stranger on the street.
Ex-
Well, welcome to today's deep dive. We are exploring social anxiety disorder today, but we have a very specific mission for you. We really want to decode the hidden mechanics of the fear of judgment.
Right, we're getting into the how and the why.
Yeah, we're going to figure out how this invisible, systematically distorted internal loop quietly dictates the daily lives, the careers, and the relationships of millions of people. And to do this, we've got a really brilliant stack of sources to work through.
We do. We're pulling from clinical diagnostic histories, some really groundbreaking psychological lab experiments, and even some eye-opening cross-cultural psychiatric data.
Because we need to be clear right from the start, I think. This isn't just about feeling a little nervous before you give a wedding toast.
No, not at all. Or, getting butterflies before a job interview. We're talking about a condition that fundamentally alters how a person moves through the physical and social world.
And I think the best place to start is by tearing down this massive invisible wall, like the gap between what the public thinks social anxiety is and how the science actually defines it.
That's a huge gap.
It really is. There is this huge, pervasive misconception that social anxiety disorder is just extreme shyness. But looking at the clinical data, shyness is really just a personality trait.
Right. It's not inherently impairing.
Mhm.
Many shy people function perfectly well. They might even, deeply enjoy their quiet nature and just prefer smaller groups.
Sure, they're perfectly happy.
Exactly. Social anxiety disorder, on the other hand, is only diagnosed when that fear of negative evaluation causes significant distress or functional impairment.
Like real, measurable disruption to your life.
Right. We're talking about a person who drops out of college because they just can't handle seminar classes, or someone who turns down a massive promotion because it involves leading meetings. And that avoidance has to be sustained for 6 months or more.
So it's not a passing phase.
No, it is a persistent, marked fear of being scrutinized, humiliated, or rejected.
There's another myth we need to bust right away, too, which is the idea that it's mostly just a fear of public speaking.
Oh, yeah, that's a big one.
Now, sure, public speaking is definitely the most commonly feared trigger, and there is a specific performance-only subtype in the clinical manuals. But our sources highlight that the generalized subtype is actually far more common and much more impairing.
Because it affects everyday acts.
Yes, mundane things. Think about the things you do without even thinking. Making small talk in an elevator, eating a sandwich in front of other people.
Using a public restroom.
Right. Initiating a phone call. The mundane triggers are what make it so exhausting to live with.
And here's what I find to be really the cruelest irony of this condition. There's this assumption that people with social anxiety just don't want social connection.
That they're just loners.
Exactly.
Yeah.
That they are aloof or misanthropic or antisocial. And that couldn't be further from the truth. The clinical literature shows that sufferers deeply, desperately want friendship and closeness.
It's the fear of judgment that drives the avoidance.
Not a lack of desire, exactly.
That mismatch, wanting connection so badly but being utterly terrified of the mechanics of getting it, that's what drives the depression that so often co-occurs with this disorder. It's a tragic catch-22.
You isolate yourself to feel safe, but then the isolation makes you miserable.
It really does. And the way the medical community has understood this suffering has, frankly, radically shifted over time. If you look at the DSM...
The Diagnostic and Statistical Manual of Mental Disorders.
Right, which is essentially the psychiatric rulebook.
Huh.
Back in 1980, with the DSM-IV, social phobia was seen as this very narrow, circumscribed thing. It was treated almost like a fear of heights, just aimed at specific performance situations.
It was very limited in scope.
Okay, let's unpack this, because the history of the DSM here is wild to me. By 1994, they renamed it social anxiety disorder and added that generalized specifier we just talked about.
Which was a big step.
But the really wild part is the change they made in 2013 with the DSM-5. Earlier, clinicians actually required that a patient had to recognize their own fear as excessive or unreasonable to even get the diagnosis.
Right. You had to have that specific insight.
Wait, so earlier clinicians thought if you didn't know your fear was irrational, you didn't have it. That seems completely backward. I mean, if you're genuinely terrified of being judged, of course you're utterly convinced the threat is real.
I totally hear why you'd say that, but put yourself in the shoes of a psychiatrist in the 1970s or 80s.
Okay, fair enough.
They were trying to create a really clear boundary between a phobia, which was seen as, a neurotic, irrational fear, and something like a delusion or psychosis, where a person has completely lost touch with reality.
Oh, I see.
Yeah, the logic was basically, if you know the fear is silly, but you still have it, it's a phobia. If you genuinely believe everyone is plotting against you, well, that's something else entirely.
Ah, okay. So it was a way of categorizing the severity of the belief itself. But in practice, that must have screened out the people who were suffering the most.
That is precisely what happened, and it's exactly why the DSM-5 eventually dropped that requirement. Clinicians finally realized that requiring insight into the irrationality of the fear was actually screening out the most severe, generalized cases.
Because they're the most convinced it's real.
Exactly. Many socially anxious patients don't think they're being irrational at all. They believe other people really are judging them as harshly as they feel they are.
Wow.
So dropping that requirement was a massive, highly consequential shift. The diagnosis moved from this narrow performance phobia to a pervasive, insight-independent pattern of fear across a person's whole social world.
Which makes sense, since the threat feels completely real to the sufferer, even if everyone else in the room is completely oblivious. We really need to transition into the mind to understand exactly how that reality is constructed.
We do. And our sources point to this landmark framework by British psychologists David Clarke and Adrian Wells.
Right, from 1995.
Yes. They mapped out this specific cognitive loop, and reading through it, it is just devastatingly effective at keeping the anxiety alive.
It is an incredibly tight, self-reinforcing loop. 5 steps. Let's walk through it, because chances are you listening to this have experienced mild versions of this yourself.
Oh, definitely. So, step 1. A social situation triggers an assumption that the self will be judged. You walk into a party, and your brain immediately says, everyone is going to think I don't belong here.
Which instantly triggers step 2, where your attention swings violently inward.
Instead of looking outward at the actual conversation.
It's exactly. Like, instead of listening to what the other person is saying, the person becomes acutely self-focused. You start monitoring your own heartbeat, the pitch of your voice, whether you're blushing or, I don't know, if your hands are sweating.
Which leads right into step 3.
Yeah.
That hyper-self-focus generates a distorted, observer's eye mental image of how you appear to others.
A fake image of yourself in your own head?
Yeah. Because you feel your heart racing and your face getting warm, your brain constructs this mental picture of yourself sweating profusely and looking visibly terrified. And this image is almost always catastrophic.
I was trying to think of how to explain this, and it's like, you're the director of a live broadcast, but you're forcing yourself to only look at the absolute worst, most unflattering camera angle.
That's a great way to put it.
You're zooming in on a slightly shaky hand, completely ignoring the wide shot where the whole room actually looks totally fine and normal. You are essentially editing your own reality to highlight your flaws.
The broadcast director analogy works really well because it explains step 4 perfectly.
Yeah.
Deploying safety behaviors.
Right.
Because you are looking at that terrible, unflattering camera angle, you naturally try to prevent the catastrophe you think is happening on screen. So you avoid eye contact, you grip your glass white-knuckled to hide a tremor.
Or you internally rehearse every single sentence 3 times before speaking.
Exactly. Or you just stay completely silent so you don't say something stupid.
And step 5 is the trap snapping shut. Those safety behaviors backfire completely. I mean, think about it. If you're whispering, avoiding eye contact, and stiffly gripping a glass, you actually end up drawing more awkward attention to yourself.
Because you look so tense.
Exactly. But even worse, the safety behaviors actively prevent you from ever gathering disconfirming evidence.
This is the crucial part.
You never learn that the conversation would have gone perfectly fine if you just relaxed, because you spent the whole time rehearsing instead of actually listening to the other person.
To see just how powerful that distorted internal broadcast is, we really have to look at a classic mirror study by psychologists Ronald Rapie and Lorna Lim.
Oh, this study is wild.
It is. So they had people with social phobia and non-anxious controls give short, impromptu speeches. Then they asked the participants to rate their own performance, and they also had independent, objective observers rate them too.
The results are mind-blowing. The non-anxious people rated themselves pretty close to what the objective observers saw. If they stumbled over a word, they knew it, and the observers knew it.
Right, their internal director was using the normal wide-angle camera.
Exactly. But the socially anxious group rated their own performance significantly worse than the objective observers did. The observers thought they did fine, but the anxious participants were convinced they had just bombed on stage.
It completely validates the Clark and Wells model. The core issue isn't that they are performing badly. It's that they are trapped with a systematically distorted internal judge.
And this is exactly why video feedback is now a standard, highly effective component of cognitive behavioral therapy for this disorder.
It's basically a requirement now.
When therapists show patients an objective video recording of their own performance, most of them are shocked. They report they look noticeably better, calmer, and more articulate than their terrifying mental image predicted.
Because it physically shatters that distorted observer's eye view you were just talking about.
Yeah.
They literally see the wide shot.
But I don't want us to make it sound like this is all just a cognitive illusion, because that distorted internal broadcast triggers a massive, highly observable physical response in the body.
The body truly believes it is under attack.
It does.
Yeah.
And there's no better way to demonstrate the biology of the gaze than a famous laboratory setup called the Trier Social Stress Test.
Calling it a stress test honestly feels like a massive understatement.
I read the methodology for this, and it is evil. They bring participants into a room and make them deliver a mock job talk speech. Then they have to perform complex mental arithmetic out loud.
Oh, math in public. The worst.
Like counting backwards from 1022 by intervals of 13. And they have to do all of this in front of a completely stone-faced, unsmiling panel of evaluators wearing white lab coats who are furiously taking notes.
And if you make a math mistake, they make you start all over again.
It sounds like an absolute nightmare.
What's fascinating here is just how profound the body's reaction is to that specific nightmare. This test remains the most widely used lab paradigm for studying physiological stress.
Because it works so well.
Exactly. Researchers use it to measure things like cortisol spikes in the saliva, heart rate variability, and sympathetic nervous system arousal.
And that sympathetic arousal, by the way, is your body's literal fight or flight alarm bell. It's the system that dumps adrenaline into your bloodstream when you encounter a predator.
And the sources show that the panel of fake judges triggers that alarm bell better than almost anything else.
Which is crazy to think about.
It is. Being watched and judged while performing reliably produces a bigger spike in stress hormones and sympathetic arousal than almost any other lab manipulation researchers have found.
Even physical pain.
Yes, including things you would assume are far more stressful, like being subjected to physical pain or extreme cold.
Wow.
The fact that a fake panel of strangers taking notes can outstress a real physical threat is a staggering demonstration of just how potent social evaluation is to the human nervous system.
Yeah.
We are deeply biologically wired to care about our status in the group.
So it's a full nervous system takeover. And the sources show this sensitivity isn't just something you pick up from a bad experience in high school. It might be planted incredibly early in life.
We're talking infants.
Yeah. Harvard developmental psychologist Jerome Kagan ran some incredible longitudinal studies looking at something he called behavioral inhibition. He observed infants as young as 4 months old.
Just tiny babies.
Right. And he exposed them to novel stimuli things like a stranger's face or even just an unfamiliar, noisy toy.
What he found was that roughly 15 to 20% of those infants showed really intense physiological arousal. They would thrash their limbs, cry vigorously, and their heart rates would spike just from seeing a new toy.
But wait, why does crying at a toy have anything to do with social anxiety later in life?
It all comes down to the amygdala.
The threat detector.
Exactly. It's the brain's threat detection center. In these highly inhibited infants, the amygdala is essentially dialed to an 11. It is hyperreactive to anything new or unpredictable.
Okay, so they're just wired to be on high alert.
Right. And when Kagan followed these children longitudinally into adolescence, he found that a meaningfully higher proportion of those highly inhibited infants went on to develop social anxiety symptoms compared to their uninhibited peers.
So the hypervigilant threat detector that was scared of a toy at 4 months old transforms into a hypervigilant social threat detector when they become teenagers.
That's exactly it.
Now, it's crucial to note that temperament is not destiny here.
No, of course not.
Not every baby who cries at a loud toy develops a clinical disorder, but it completely reframes social anxiety disorder. It has a visible biological seed decades before the diagnostic criteria could ever apply.
Which ties perfectly back to when the term social phobia was actually coined in the clinical literature.
Oh, right, by British psychiatrists Isaac Marks and Michael Gelder.
Yes, in 1966. They noticed something that the reigning Freudian psychoanalytic frameworks of the time were totally missing.
Because Freud was all about hidden childhood conflicts.
Right, but some patients weren't afraid of objects or animals or being trapped in open spaces like with agoraphobia. They were specifically terrified of being watched and judged.
And the key clue for them was when this fear started. Marx and Gelder observed that this fear of judgment consistently emerged in adolescence.
Which is very telling.
Yeah. Agoraphobia, for instance, tends to emerge much later in adulthood. This adolescent onset suggested they were looking at a separate, distinct underlying condition, not just a variant of general anxiety.
And it makes perfect sense.
Wow.
Adolescence is the exact developmental window when the social gaze becomes paramount.
It's when you suddenly realize that your peers are actually evaluating you.
Okay, so we have intense biological roots, early temperament seeds in the amygdala, and very specific cognitive loops. You would think diagnosing this would be totally black and white.
You would think so.
But the boundaries of this disorder are actually incredibly controversial. They are heavily debated and heavily influenced by the society we live in.
This brings us to a major fault line in the field, which is the medicalization controversy. In the 1980s, an American psychiatrist named Michael Liebowitz argued that the condition was severely under-recognized.
He developed a diagnostic scale that is still used today, actually.
Right. And his group's work eventually contributed to a massive shift in 1999 when a drug called paroxetine brand name Paxil became the first SSRI to receive FDA approval specifically for social anxiety disorder.
And we should clarify for the listener. An SSRI is a selective serotonin reuptake inhibitor. It's a class of medication that alters brain chemistry, specifically by increasing the availability of serotonin to reduce anxiety and depressive symptoms.
Right, a common antidepressant. And that 1999 FDA approval was a watershed moment. It moved the disorder from an academic curiosity into a broadly recognized mainstream diagnosis.
It was also accompanied by a massive direct-to-consumer marketing campaign by the pharmaceutical company.
A huge campaign. They used this incredibly evocative tagline, "Imagine being allergic to people."
That is a very strong image.
Extremely strong. And they started framing social anxiety as America's third most common mental health problem.
Which, predictably, sparked immediate and intense backlash from sociologists and other critics. People like Christopher Lane argue that this marketing effectively blurred the line between a genuine impairing disorder and ordinary everyday shyness.
Because they were selling a product.
Right. The critique is that pharmaceutical marketing helped manufacture demand for a pill by expanding the boundaries of the diagnosis itself. Suddenly, feeling awkward at a cocktail party was being medicalized.
And we want to be very clear here for you listening. We aren't here to take a side on the pharmaceutical industry or the critics. We're just impartially reporting on this deeply contested question. Where exactly does normal human shyness end and a psychiatric disorder begin?
It's a very blurry line.
And frankly, who gets to draw that line? Is it the patient, the doctor, or the culture at large?
It's a debate about boundaries that extends into other diagnoses as well, actually.
Like what?
Well, for example, there is an ongoing, heavily heated debate about whether generalized social anxiety disorder and avoidant personality disorder are actually two different conditions, or just two labels for the exact same thing.
Oh, interesting.
Yeah, avoidant personality disorder is marked by pervasive social inhibition, feelings of inadequacy, and an extreme hypersensitivity to criticism.
Which sounds exactly like the five-step Clark and Wells loop we've been talking about.
Precisely. Studies routinely find a huge overlap. A large proportion of people diagnosed with generalized social anxiety disorder also perfectly meet the criteria for avoidant personality disorder.
So it's basically the same thing.
Some researchers argue we should just drop avoidant personality disorder entirely as a redundant category, but others insist that the personality level framing captures something much deeper.
How so?
They argue that when the fear of judgment becomes so deeply ingrained in who you are, calling it a simple anxiety disorder doesn't do justice to the suffering. It's really a debate about how we categorize human pain.
Here's where it gets really interesting, though. If we want to see how culture shapes the way we draw these lines, we have to look outside the West. Let's look at Japan.
Yes, the cross-cultural data is fascinating here.
In Japan, clinicians describe a culturally specific syndrome called Taijin Kyufusho. It translates roughly to the fear of interpersonal relations. But the direction of the fear is completely reversed from the Western model.
Think about the Western loop we discussed earlier. The fear is that you will look foolish.
Right, it's very self-centered.
In Taijin Kyofisho, sufferers fear that some aspect of themselves, like their intrusive gaze, their body odor, their facial expression, will offend, embarrass, or burden other people.
Wait, so if Taijin Kyufusho completely flips the fear from I will be judged to I will burden others, doesn't that suggest our Western definition of social anxiety is basically holding up a mirror to our highly individualistic culture?
It strongly suggests exactly that. It is powerful evidence that the neural and attentional machinery of social anxiety, that hypervigilant amygdala, the hyper-awareness of the social gaze, that's universal.
That's the hardware.
Exactly. That is the hardware. But the software, the actual content of the fear, is culturally programmed.
Wow.
In the West, the culture emphasizes individual self-presentation and standing out. So the fear becomes, I will fail at presenting myself. In Japanese social norms, where harmony and not burdening the collective are heavily emphasized, the fear naturally becomes, I will disrupt the harmony.
The brain just finds whatever threat the culture tells it is most important.
That's it, exactly.
So whether it is culturally shaped or biologically driven, this fear of judgment is colliding with our modern environment in some really unprecedented high-stakes ways. The real-world impact of this is just staggering.
We're talking about a disorder that dictates major life choices during the most crucial developmental windows like adolescence and early adulthood.
Which is the exact time when you are supposed to be building your social skills, your professional network, your romantic life.
And if this condition goes untreated, the avoidance behaviors just take over. People might not apply for promotions that involve client-facing work, settling for careers well below their potential.
They stay silent in meetings, so their ideas are never heard.
They avoid forming romantic relationships. The trajectory of a person's entire life can be altered by that invisible courtroom in their head.
And because the internal distress is so high, the risk of self-medication is severely elevated. Our sources note a very strong, well-documented link to alcohol use disorder.
Which makes sense, tragically.
People use alcohol, whether they consciously realize it or not, as a chemical safety behavior to blunt the anxiety in social settings.
We also really need to address the myth of willpower here. There is this terrible, well-meaning advice often given to people with social anxiety. Just push through it. Face your fears.
Just put yourself out there.
Right. But because this disorder is maintained by that specific cognitive loop, just pushing through while deploying your safety behaviors actually reinforces the disorder.
Let's break down why that is, because this is crucial for you listening. Say you force yourself to go to a networking event. You push through, but you do it by gripping your drink, standing in the corner, never making eye contact, and mentally rehearsing everything you say before you say it.
You're fully in step 4.
Exactly. Because you relied on those crutches, you never let your brain learn that you were actually safe. You block the corrective learning. You walk away thinking, I only survived because I hid in the corner.
That is exactly why structured cognitive behavioral therapy works so much better than unguided exposure. A therapist will explicitly force you to drop those safety behaviors.
They don't let you hide.
No, they will make you go to a party and deliberately spill a drink or ask a silly question without rehearsing it, so your brain can finally register that the catastrophe doesn't actually happen. You can't just white-knuckle your way out of a distorted reality. You have to dismantle the loop.
And think about how hard it is to dismantle that loop today. Think about remote work. Think about the endless video calls you sit on every week.
If we connect this to the bigger picture, our modern digital era has essentially mass-produced the exact core triggers of this disorder.
The Zoom effect. I was reading the sources on this and the connection just clicked perfectly. Think about the last time you were on a video call. Your own face is displayed back at you in a small box for hours on end.
It's unavoidable.
It is literally a technologically manufactured version of the self-focused attention that Clark and Wells identified in their loop. We have built machines that force everyone into step 2 of the anxiety cycle.
You aren't just looking at your colleagues. You are forced to monitor your own expressions in real time.
Which is exhausting for anyone.
It is. It makes understanding this information vital for absolutely everyone, not just those with a clinical diagnosis.
Yeah.
The modern environment is practically designed to trigger social evaluation anxiety, We are constantly performing for an audience, whether it's on a video call or curating an image on social media.
So let's bring it all together. We have journeyed from a misunderstood, supposedly narrow performance phobia into the heart of a complex cognitive loop driven by a profound fear of negative evaluation.
We've covered a lot of ground.
We've seen how it has a biological seed that can be spotted in the amygdalas of infants, how it rivals physical pain in a laboratory setting, and how cultural values shape its very nature. So what does this all mean?
Well, it means that understanding these mechanics isn't just about clinical knowledge. It's about cultivating deep empathy.
Yeah.
Empathy for your colleagues who might be perfectly brilliant but are terrified to speak up on a video call. Empathy for your friends who might seem distant or aloof but are actually just trapped in their own heads, desperately wanting to connect.
And frankly, empathy for yourself when you feel completely socially exhausted after a long day of feeling watched.
Definitely. Be kind to yourself.
To leave you with one final thought, I want to introduce you to a concept from social psychology called the spotlight effect. Back in the year 2000, researchers Thomas Gilovich and Kenneth Savitsky proved that ordinary people, not just clinical populations, but everyone, systematically overestimate how much other people notice and remember about their appearance and their blunders.
We all think everyone is watching us.
We do. You spill coffee on your shirt, you think the whole room is staring and judging you. The reality is almost nobody noticed because everyone else is too busy worrying about their own shirts.
This raises a really important question, I think. If social anxiety disorder is essentially just this universal, deeply human cognitive bias turned up to a clinically disabling intensity, what does that say about the normal baseline of human self-obsession?
Are we all, to some degree, starring in a live broadcast that no one else is actually watching? Are we all holding an invisible trial in our heads, slamming the gavel down on ourselves, when the rest of the world is really just trying to buy their coffee? It's something to think about the next time you feel the eyes of the room on you. Thanks for joining us on this deep dive.